listening to 88.5 WMNF Tampa, your community radio station.
The opinions presented on the Healthy Steps show are the evidence-based opinions of Dr. Fred Harvey, the callers, and his guests. These are not the opinions of the staff, the volunteers, or the board of WMNF. The information provided on the show is not intended to diagnose or treat any disease. There is no implied patient-physician relationship in these calls. The nature of the calls is educational and informational only.
Good morning, my faithful companions of the airwaves. You MNFers are marvelous. You who faithfully sets your dial to WMNF Tampa, your resistance radio station from Tampa Bay to the Gulf of Mexico, and, when he's not being relentlessly pursued, the only astute community-supported radio station that Richard Kimball streams, and you can stream us as well at WMNF.org. Today is Ask Me Anything Monday, and that is a deep well of possibilities. The whole shebang depends on your medical questions, comments, and concerns. So let's keep my favorite phone answering megastar, Maddie, busy this morning. Just give us a call at 813-239-9663. I know that you have that in your notes, but I'll do it once again. That number to call is 813-239-9663. You can also send an email to dj@wmnf.org. And last but not least, you can also send us a text at 813-433-0885. Good morning to you, Dr. Harvey. Let me do my talking bullet point introduction. This is Ask Me Anything Monday. What have you got for us today to get started, Dr. Fred?
Well, good morning, and thank you for that intro, Bill.
Always my pleasure. And how was your Thanksgiving?
I had a very nice, quiet Thanksgiving. Basically, I was recovering from emptying my office.
Yeah, you said you were going to be clearing on out. That must have been, I guess, one dickens of a task.
Actually, I've been working on it for months, slowly taking things out. So it was just down to the last few things. And we have a lovely person coming today to pick up all of the office furniture and repurpose that to people who have lost their homes. And cool. I had a doctor who was starting up a new practice in February, but unfortunately had no place to store some equipment until then. And I have 2 exam tables she was going to take, but they're still in the office. And the home furnisher doesn't want exam tables, but if anybody out there wants to call the office, 941-650-3579, I have a donation to a clinic, a free clinic, anybody who needs medical exam tables that are functional.
Oh, that's a very good offer.
Yeah, if you want to just show up, table paper, gowns, sheets, all kinds of stuff. But unfortunately, it's going to go to the junk man if nobody comes for it.
That would be a sad waste.
Yes, I agree. But everything else is done, and looking forward to this whole new world of virtual medicine.
That all sounds like an adventure for you. And before we get started here, I'd like to mention that I've got Sage answering the phones today, not Maddie, so I appreciate Sage coming on in. He's going to be the new lead.
Thank you, Sage, for coming in. Well, today is World AIDS Day, and I just want to really talk about that a bit. We've come a long way. It's been really an incredible, practically 40 years here. And it's really interesting that we're having kind of a deja vu. You know, the person who was president when the AIDS epidemic broke was a horrid homophobe and put the brakes on all kinds of AIDS research. And devastated the AIDS community until the gay community came together with activism and got the government to actually do something. And it's been quite effective. But unfortunately, we have another homophobe in the office, and a really stingy, weird one that is a felon. I mean, why do we listen to a felon when he does this kinds of stuff to us? The Trump State Department is now not allowed to mention World AIDS Day. Yeah. not allowed to participate in a global commemoration of this pandemic. And the reason they're stated officially as saying that awareness is not a strategy. My God. These people are horrid in that awareness is what it's all about. You know, knowledge of how this actually, I mean, I'm flabbergasted. It's really hard to come up with a way to talk about this. I mean, knowledge is power. And what this administration wants health idiots? Make Americans hurt always? This is the plan? This week it's not the secretary. This is the president's directive to hurt people. You know, we have direct clinical evidence that shows that knowledge, that prevention programs that last a day, a week, 6 weeks, teaching people about what HIV is, how it transmits, what it does, what AIDS is. You know, increasing the knowledge of transmission changes behavior. Increasing the knowledge of how it is transmitted increases condom use. And what's amazing is that it decreases sexually transmitted infections by 40+%, 40% decrease. Our goal here is to stop new infections because the infection lasts forever and requires medication ongoing. We want to prevent this. It's almost as if the homophobia and racism of this administration is combining to try and kill more people. Because, you know, the highest incidence of new cases is in black women in the South. 50% of all new female cases are black. But black women make up only 13% of all Americans. So there's a problem here. And there's a lot of layers to this. It's got to do with culture, the down low black man that won't talk about it, bisexuality, and then there's just the horrible amount of lack of access. I mean, I think you have to look at the the fact that this administration has decided to get rid of Planned Parenthood. Planned Parenthood provides preventive health care for women, poor women. So this is almost as if it's an attack on black women to make sure that they get more HIV, to make sure that population gets culled by an epidemic that won't be treated because we're going to have less access to medication. They're making sure that health premiums go up, that medications are less covered. There's a problem here. It's almost as if this administration wants AIDS to kill more people purposefully because it seems to be actually associated with people this president doesn't like. And he does target people that he doesn't like. But you know, there are only 30,000 new cases a year now. It was hundreds of thousands at the highest peak of the pandemic. Federal cuts hurt Americans. And, you know, cuts to PEPFAR, which is the global prevention program, and UN AIDS are already documenting increases in deaths because of the pullback on aid that started last year. And, you know, people need care. This is a system-wide devastation. This is planned pain for Americans because cutting the professional designation from registered nurses is criminal. Cutting the professional designation from these very valuable healthcare workers makes them a commodity. And it also removes their ability to get funding for their student loans. So we're going to see a decrease in nursing as we have an increase in the aging population. This is purposefully going to strain poor people and poor people's families. They won't be able to get caregiving. outside the home because Medicaid pays for this stuff. And then we have to have nurses to actually cover it. If there's no staff, who's going to do it? This administration is engineering the largest healthcare crisis for America ever, because we won't have the resources to be in place to help with the next pandemic. And I got to tell you that red light therapy and Shilajit is not going to cure your next pandemic. But I'd like to talk about that. And this is Dr. Fred Harvey, and we are on the Healthy Steps Show.
Yes, and I want to say that I do have Victoria waiting patiently right now. She just checked on into the phone queue, and you are invited to address your medical questions or concerns on the Healthy Steps radio show with Dr. Fred Harvey by dialing 813-239-9663. Again, that number is 813-239-9663. I've got Sage answering the phones, and she'd love to have a little chat with you as she puts you in the queue. So you can give us a call, and you can also text us at dj@wmnf.org. Let's go to Victoria in St. Pete. Good morning, Victoria.
Good morning. I had an allergic reaction to a drug called Vtama, which is also tapinarof cream, 1%. I got eczema on my hands because I have an allergy to different soaps and hand sanitizers and such. And the allergist gave me this, and it worked really well for a while, and I think I might have put too much on, but I have a severe rash, almost like a burn on the top of my hands, and it goes up the inside of my arm to my elbow.
Wow.
Yeah. So it's very, it itches, it's painful, and I looked at the instructions again. It said that it can cause folliculitis.
Mm-hmm. So did you tell your dermatologist?
I told my allergist, who's out of town till tomorrow. I have an appointment, but I was just wondering if there's anything I can do to soothe it. I've been putting all kinds of different things on it. I read vinegar would help it, and it did to a certain extent. And now I'm putting an oxygenated olive oil on it.
Huh. And what's the cream called that you used?
Vtama.
How do you spell that?
Vtama. And it's also called tapinarof, Tapinarof, 1%.
Gotcha. Yeah, it's let's see, they use it for psoriasis and atopic dermatitis. And it can cause raised red bumps around your hair pores. Is that what you seem to be having?
Yes.
Yeah.
And it's now drying out, and my hands are swollen, very swollen.
Oh, yeah. It sounds like you had a pretty bad reaction to it. How long did it take you to get that? A month? A couple weeks?
Maybe a couple of weeks or less.
Yeah, it takes about 2 weeks to sensitize to something, and then you can get a nice reaction. So steroid cream might reduce that. I don't know. I've not seen anybody use this
before, and that seemed to be burning my skin as well. So sometimes creams have irritants in them. Ointments tend to be less irritating. You might need an ointment. This is, let me tell you what I've been using. Betamethasone, dipropionate.
But it's a cream.
It's in a tube. I don't know.
It'll say on there cream or ointment.
Oh, yeah, cream.
Yeah. Ointments are carried in petrolatum. It has very low reactivity. And so if you react to cream-based steroids, ointment-based steroids are probably more tolerated. And when you have a contact dermatitis like you've got, it probably would respond to a steroid cream. But if the one that you've got burns, you might want to try something different. But your allergist is going to be back tomorrow. That would probably be the best choice. Okay.
All right. I appreciate it.
Best wishes with that.
Thank you. Bye-bye.
Bye-bye.
Thank you there, Victoria. And let's go to Kevin in Brooksville. Good morning, Kevin.
Good morning, Dr. Harvey.
Hi, Kevin. How are you today?
I'm fine. And the intro you had is stunningly ironic that we all are suffering from the same pain in the butt. But and this is not funny. My wife has chronic pain from an anal fissure, and it started in February with a wellness. We went to a doctor, and he said to give us a lot of to use all of the over the counter. We did that, and then her gynecologist gave her some suppositories, hydrocortisone acetate, and then a gastroenterologist gave her nitroglycerin cream, and another gastro gave her nifedipine. Nifedipine.
Nifedipine.
With lidocaine and gabapentin, which didn't work. And then now we went to each of these we went to these doctors. The surgeon gave her diltiazem and Lido, and we've arranged, and that hasn't worked. And so we're at this point to consider surgery. We've got an appointment, and it doesn't include cutting. It's just numbing the sphincter, the upper sphincter, the one that's involuntary, and numb with Botox to stop the spasms that keep this sore open. And I just wondered, we're at that point, and I wondered what you had, if you had any advice,
So have you tried anything to change the gastrointestinal microbiome? Has anybody looked at the microbiome? Anything like that?
No, just nothing like that. She has what's considered a tortuous bowel, which complex. It makes everything more difficult.
And has anybody addressed the tortuous bowel with changes in, say, probiotics or fiber or dietary choices or looking for food sensitivities?
Lots of water and fruits and vegetables. We have done that, and actually, this came out of nowhere. It did start in February, and it's now 9 months or so into this. And
what was going on in January and February when this occurred?
Nothing abnormal. Nothing that we knew that it may have caused it. Having had years of cramps and pain, and we worked with her to get the stools softer. Years
of cramps and pain. Yeah, that's it. So nobody's looked at the microbiome.
No.
Okay. I think that your wife, before doing invasive poisoning with Botox, might want to consider seeing a doctor who will do a stool test and maybe a metabolomic test to see how the systems are running. Is there enough protein on board to heal the fissure? Are there pathogenic bacteria or yeast that are interfering with healing? Are there foods that she is sensitive to that are causing constant irritation in there?
Okay. I don't think, I'm not sure. The stool test we could do, that's for sure. And the metabolic.
You could do all of those tests if you go to a doctor who deals with those things. You can even go to any lab test now and order some of the stuff on your own. But it does help to have a doctor who's experienced in it to help you understand what these things mean.
Okay.
Where are you?
Pardon me?
Where are you?
We're in the state of Florida.
Yeah, so you're in Florida. So if you go to Institute for Functional Medicine.org, they have a physician finder for in your area. You can actually do a search and see if you can find somebody in 25 miles radius or something to see if you can see a functional doctor who will help your wife with this problem. Because obviously nobody else has been able to find a helping answer.
It's true. Yes.
Time to look outside the system of repeating the same thing over and over again. Because I got to tell you, diltiazem and nifedipine and nitroglycerin all do the same thing. So they gave you 3 different medicines that do the same thing that still didn't result in any different answer.
That's a fact. Okay. Well, thank you.
You're very welcome.
Have a good day. Thanks.
Yes, and good luck to your wife on that. I would say food sensitivity, stool test, metabolomic test, figure out what's going on.
ifm.org. Okay. Thanks.
Yep. You're welcome.
Thank you there, Kevin. And I do have Jerry from St. Pete in the queue, but after him, I think it's going to be a little quiet. So I want to remind folks you're listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. We're inviting you to participate by asking your medical questions or concerns by calling 813-239-9663. You can also send your emails to dj@wmnf.org. Good morning to you, Jerry.
Good morning, guys. Happy end of the year and then advance Merry Christmas.
Yes.
How are you doing?
Fantastic. How are you today, Jerry?
I'm doing great. It's a beautiful day, and I'm glad I can completely listen to your show. It happened right when my work began, but my schedule changed, so I'm very excited about listening to your show in full, and I get a question in.
Yes.
So I'm a farmer, and I've been in the sun, landscape architecture, and so I'm getting these lesions on my head that I probably need to get checked out. And I wanted to know specifically, I'm more concerned about the aesthetics. So I wanted to know the generalized practice of getting rid of them. Are they done with a laser? Are they done with some kind of acid? Or when you go to get them taken off, I wanted you to elaborate on those. And I was wondering if I could I imagine getting like a deal on some laser setup where they just get zapped.
Something like that, yeah. So what you're talking about is solar damaged skin, and you can get keratoses, which are like scaly, thick things. They might actually degenerate into cancer. And you can get other cancers, basal cells and squamous cells that can be hiding there underneath some of that flaky stuff. Another thing that happens with age is seborrheic keratosis. They're darker spots, a little greasy looking, but all of these things can come off. The ones that are solar damage associated, they have several different ways of going about it. They used to give you a chemotherapy called...
What's the best way? I mean, what's your recommendation as the best choice?
Well, the best way is the way that is best for you. So it depends on how many lesions you have, how thick and nasty they are, and kind of like whether you've been treated before. So I've had something called blue light therapy. They put a reactive chemical on your skin and let it sink in for 10 minutes or something. This absorbs into the cells that are dividing too fast, and the ultraviolet blue light that hits it reacts with the chemical, and then those scaly things kind of slough off over the next couple weeks. It doesn't create a big burn, but it works pretty effectively. There are still some left behind. Possibly doing it every 2 years or something like that could be something to consider. But they also will laser specific ones. They will use liquid nitrogen on, solid lesions, bigger ones. They will use 5-fluorouracil, which is a chemotherapy, which does cause a skin burn because it will affect all the cells, but more so the ones that are dividing faster in the scaly, crusty things. So there's lots of different methods. You need a good dermatologist, and they will help advise you as to which method is best for your situation.
Okay, now now I heard you were closing your practice or something like that. I want you to elaborate at least by the end of the show
I'll tell you right now, I don't do dermatology, so I don't do those kinds of procedures. I used to do a little bit of that when I did primary care, but I've shifted to a virtual digital practice, Zoom meetings only, because I don't do physical medicine anymore. I do metabolic coaching and lifestyle and spiritual and emotional coaching and help people find solutions for their chronic illness.
I like it. I like it. Well, can I call you for some recommendations?
Well, you could do that. You could also.
You're the only doctor I trust in these towns. I'm serious. I'm not joking. You're the only guy that I would go to. I mean, really.
You can definitely check my website, but there's lots of good doctors like me all around the country and the world, and you find them at ifm.org. Because
go to ifm.org. Start there.
Yeah, if you want somebody right near you, that's easy, and I can go anywhere in the country basically because I'm virtual now.
Okay, good. Well, good. Well, yeah. Well, just I got it. I got it. Well, I'm really glad to get the question in. You've answered it. Thanks a lot for your.
You definitely need a dermatologist though.
Yes. So you're still going to do your show, though. You're still going to do your show.
I'm going to be doing my show. I'm going to be doing more stuff online. I'm going to be doing more education. I'm going to be doing community building. There's going to be stuff showing up on Facebook, all kinds of fun stuff that's not medical.
WMNF are the greatest asset that I found since returning from Hawaii after 45 years. I'm dead serious. I tell that to everybody. Okay?
Wonderful. Glad you're here.
All right. Have a good day. Thank you.
You too. Thank you.
Thank you, Jerry, and thanks for that very fantastic shout on out to the greatness of WMNF and what we offer to the community, and that what the Healthy Steps Show with Dr. Fred Harvey brings to the community. Quite a wealth. And you are listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa, and you're encouraged to participate with your medical questions or concerns by calling 813-239-9663. Again, that number is 813-239-9663. And continue to send your emails to dj@wmnf.org. And you can text us at 813-433-0885. And I do have Jerry from Clearwater on the line. Good morning, Jerry.
Good morning. I was just listening to that fella asking you about recommendations. You know, he can go to almost any health food store, and they've got magazines that are full of the type of doctor that you've been talking about and that you are. But
that's true.
The problem with that is most of the medicine available out there now, doctors available out there now, other than that type, are part of private investment groups, and they don't honor insurance for vitamin checks and, you know what I mean, the kind of.
Well, actually, no one really honors insurance for vitamin checks. Medicare doesn't pay for that, and most insurance companies follow suit on that. But Medicare is the best at covering those things. The metabolome test that I do that looks at nutrition actually is covered once a year by Medicare, but no other private insurance will
Medicare,
do it.
But these younger people that are under 65 not necessarily are. And a lot of times those doctors in those magazines, you know, the throwouts, I call them, that they've got at throughout with the health food stores.
Sure.
They mention a lot of doctors that do stuff like that. Now, as far as that other fellow in the women's issues, you know, one thing that is really, really overlooked that causes a myriad of problems, and it doesn't necessarily symptomize as it is said, and that is systemic lupus. My wife has had it for 25 years. She's now blind because of it, and in kidney failure, and the last treatment on the books didn't work.
Wow. I'm gonna guess.
She's got a protein of 2,400 now, so it's creeping up. This is not good. But anyway, a lot of things are treated that are actually lupus, and they don't want to go through that nuclear test because it's an expensive proposition.
Actually, no, the ANA test is a cheap proposition, and a lot of doctors will order it to see what's going on there. But I bet that your wife's progressive and not responsive lupus has not been addressed by a functional doctor, because usually it calms down if we figure out what's causing the inflammation. So has she had a stool test?
It lay dormant. It was dormant for over 10 years after a process that.
Right, but it came back.
Yeah, it came back. And
so has she had a stool test yet?
Pardon me?
Has she had a poop test? Has she had a stool test?
Oh, yes. Every kind of test imaginable I've run.
Oh, really? So she has seen a functional medicine doctor?
Functional medicine, no.
Oh, okay. So she's not had a stool test. She should really consider going to a functional medicine doctor. What's that?
She had one when she was in the hospital, so
They don't do that kind of stool test. They don't do that kind of stool test in the hospital.
Oh, they were looking for something else then.
Yes, exactly. She probably should see someone who deals with this, because functional medicine deals with chronic inflammatory illness and helps people get better rather than just covering it up with biologic medicines.
Yeah, well, that damn Plaquenil blinded her. And she's Asian, and this is another issue in medicine that you have to be careful about, is actually there are medicinal differences within the races, how medicine reacts.
Very little, actually. What we've seen over the last 100 years is there's very little difference between how races, because there's only one race, the human race, and so the human race responds to medication pretty much similarly across the board.
Oh, I'm Scotch-Irish, and people from Europe are more tended to respiratory issues.
Well, you're reading racist information.
Stuff.
Yeah, you're reading racist information.
Oh, I am? Really?
Yeah. Yeah, you are. Much of the information that doctors were trained on, much of what doctors were trained on in Western medicine is racist wives' tales. We're finding out so much of this stuff is actually harmful, that we were taught about racial differences.
Because if it's not JAMA or Mayo Clinic or some real respected medical institution, I usually don't pay any attention to it, because...
And that's who actually published this data.
I'm on oxygen 24/7.
Yeah, you should pay attention to the data that JAMA put out about how race has infected the way doctors look at healthcare.
I'll look that up today.
Excellent.
Thank you.
You're welcome.
Thank you very much. I appreciate the guidance, but they have found that, like, Plaquenil has a more detrimental effect on just the eyes specifically.
Plaquenil does, if the doctor is negligent and doesn't follow the patient's eyes while on Plaquenil, injury can occur. But if you pay attention, you can actually stop the injury. But unfortunately, somebody wasn't paying attention there.
She wasn't.
Yeah, so I'd suggest get your wife to a good functional doctor so you can get a workup of why she has the inflammation.
Yeah, she's so stoic that it's hard to... She lies. I can take one look at her and tell her that, this isn't right today. She says, oh, no, I'm fine.
Oh, I know about that. I deal with elderly parents, and they don't like to tell you what's going on.
Well, it's my wife.
I got it. She's also a stoic. They do that. So,
it's just like me at 70. Oh,
Jerry, best wishes with getting your wife to some therapy.
I will get my wife to one of those.
Good.
I'll read
Take care.
the Dom article today. Thank you very much.
You're welcome, sir. Have a great holiday.
Okay, and I've got Sydney and Andrew on the line. Let's go to Sydney and Ruskin. Good morning, Sydney.
Hello.
Good morning, Sydney.
Hello.
You're not coming through.
Pardon?
There you are. I can hear you now.
Okay. Can you hear me?
I can hear you.
Okay. I fell several days ago and broke 3 ribs, and went to the ER and they gave me some medicine. Then I got what, not any better, and I ended up with pneumonia. They sent me home on a home oxygen, which my room air sat 75. On the oxygen, it's 95. My husband says I'll never come off this oxygen. Now, my question is, when the pneumonia heals up, will I not be able to come off the oxygen?
Well, that's something you will have to determine at that point. I don't know what else is going on with your lungs, whether you have any underlying lung pathology. You might have something there underneath the pneumonia, but I think it's just a matter of time.
COPD.
Well, if you have COPD, you may need oxygen, but you may not. So I think it's going to be a watchful waiting period for at least a month.
Uh-huh. Okay, I've been on it for about 3 days now.
Yeah, well, you're going to take at least a month, if not 2, to recover from a pneumonia.
How long?
A month or 2, because your lung was injured with a fall with broken ribs, so the lung is bruised, and then it got infected. And so you have a bruise and an infection, and that's going to take a while to heal. And so you might need oxygen for longer than you expect.
Uh-huh. Okay.
Now, Sydney, could I get you to turn your radio on off, please?
Oh, yeah, let me get out of the chair.
Your lung was injured with a fall with broken ribs. So
Okay, is that better?
I hope.
Yes, uh-huh.
Okay, well,
So,
I just... What, have you got anything else to tell me? Besides
what else would you like to know about it?
Nothing. Just
Okay, good.
that I will eventually get off this oxygen because it's a tank about 18 inches tall, size of a dinner plate. I can't... I've got
Well,
a
you
long
can
hose
actually
to get around the house.
If you end up on chronic oxygen, you can get an oxygen concentrator that's the size of a small boombox.
Yeah, well, aren't they pretty expensive?
Medicare pays for them.
Medicare will pay for it, okay.
Yes.
Because I have Medicare and a supplement.
Good, good. So they should cover long-term oxygen should your doctor order that.
Okay.
All right?
All right. Well, thank you for your help.
You're welcome. Hey, if you want to get that pneumonia to clear up and move that mucus along, get a supplement called N-acetylcysteine, NAC. It helps to break up mucus. They give it by nebulizer to people in the hospital that have really thick mucus. But you can take a capsule of it with your meals.
Yeah, I have a nebulizer at home, Duaneb.
Okay, good. That's good to use. But to help get rid of the mucus, you can take a pill called N-acetylcysteine. It's a nutritional supplement that helps to make your mucus get more thin.
Okay.
So best wishes on that. Hope you feel better soon.
Thank you, sir. Yeah, thank you for talking to me. Goodbye.
You're welcome. Bye-bye.
Indeed, Sydney, and thank you for calling on in. I've got Andrew from St. Pete and then DeAndre. Good morning, Andrew.
Yes.
Hi there.
I was diagnosed with what they call low-risk prostate cancer back early spring, and I've been looking into mushrooms, and I was just going to ask you if you had any, knowledge about the different kind of mushrooms. I read a little bit about turkey tail and reishi, but I'd just like to know what else I could do.
I would include reishi, maitake, turkey tail, lion's mane. Yes, include those in your diet on a regular basis. Hen of the woods, maitake is wonderful if you douse it with a little bit of a mixture of crushed garlic, a little bit of rosemary, and salt, pepper, and olive oil, and you drizzle that over top of the hen of the woods and put it in your air fryer after you've broken apart the thing into chunks. It's almost like tenderloin tips. It's delicious food.
What did you say I should put it over?
Maitake, Maitake. That's another type of mushroom. I don't really.
Yeah, I'm familiar with it. I've seen the powder.
Okay, so I don't do much in the way of powder or supplementation like that. I eat them. I'm not really much into taking many pills, and I don't believe in the idea of taking a mushroom to treat prostate cancer. I don't believe in taking any supplement to treat prostate cancer because I don't believe that happens. What I do believe in...
They told me it's just a watch situation right now.
Right, so you have prostate cancer and you're watching it. But since the urologist wants to actually do surgery and the radiation oncologist wants to do radiation, they're not doing anything and they're not telling you to do anything. Watchful waiting is stupidity for me. It's Western medicine's way of saying, well, wait until we get a really serious disease that we can actually spend money on and treat. But my approach is, rather than watchful waiting, how about proactive prevention? Let's keep it from going somewhere else. And one of the best things that I would suggest you could do is to go and look at Dean Ornish's website, Ornish. He has a book about reversing prostate cancer. He has a clinical research that proved that if you do meditation, exercise, and a vegetarian diet, you will turn off 600 different genes that signal your body to make prostate cancer.
Okay, well, I'm pretty healthy as far as exercise is concerned. But,
okay, are you doing the vegetarian diet?
No, I'm not a vegetarian. And
do you meditate every day?
Yeah, mostly. And then
Good,
I train martial arts.
So,
martial arts.
I would suggest that you look at what Dean's talking about, broaden your diet in the way he's suggesting, and then consider some other supplementation that might help. But I can tell you one thing that, or several things that affect cancer cell growth. One of them is resveratrol, or its relative pterostilbene, which is methylated resveratrol. This turns off cancer. Curcumin from turmeric turns off cancer.
I take 2 grams every day.
Okay, epigallocatechin gallate from green tea turns off cancer, and sulforaphane from all the brassica vegetables, especially broccoli sprouts, turns off cancer. So there's 4 nutrients that we know that interfere with cancer cell growth.
Okay.
Directly. They tell it to die.
So curcumin, green tea, and
resveratrol,
cruciferous vegetables,
and the brassica vegetables for sulforaphane. So you can get all of these things just by eating the foods. Pterostilbene. Not many people eat Japanese knotweed root, but many people drink a little bit of red wine. That's where the resveratrol is. But you can take a supplement of that also. There are very few that I recommend, but these are some of the more potent ones that are useful, that direct the cancer metabolism away from cancer.
Okay, well, I got 3 of them that I do on a fairly regular basis.
Excellent.
So I'll just increase them. Well, I don't know. They say if you increase curcumin, you get it can hurt your stomach. Is that true?
No, it just actually, if you have too much protein, you probably won't digest it well. But what you want to do is look at the quality of protein and the fat that goes with it. Because when you eat animal fat and the saturated fat goes, or animal protein and the saturated fat is in there, and if you're not eating grass-finished, pastured animals, you're eating hormone-manipulated meat, and so that may promote more hormone-related cancer growth. And so avoiding the animal products when you have a hormone-related tumor is probably a good idea.
Okay. All right. Well, yeah, I don't eat that much. I don't eat that much red meat. I eat more chicken and fish, but
very good. Yeah, fish I think is fine.
I can modify that. All right. Well, I appreciate a lot of that. And Dean Ornish, that's the guy's name? Ornish, the website?
Ornish.
Okay. I will look him up.
Okay, great.
Thanks for your help. Thank you.
You're welcome.
Thank you very much there, Andrew. Let's go to DeAndre in Brandon. Good morning, DeAndre.
Hey, good morning. Thank you. I was calling for a relative they were suggested by professionals for a while that they can use CBD and THC gummies to help deal with bursitis and arthritis. There's some nerve damage along the tract, I guess, on their right side. And then after having success, tremendous success for what I saw, being able to like walk the dog and such, they were then told no, there could be heart complications if you were to continue. And not necessarily by the same person, but still it was all of a sudden just this upending. And I was just curious, what's the criteria for considering using those, to help deal with pain? They were able to put away so much in pharmaceuticals for a while, and then that was just all turned off.
So my question really in reverse is, what kind of compassionless, weird practitioner would tell someone to stop something that was helping and then let them suffer? WTF?
Yeah.
They paid them for this bad advice?
I don't know.
Or is this just a relative that told them, oh my? Was it Dr. Google or was it a real human?
I'm convinced it was their primary care physician. And,
you know what? Primary care doctors are in the business of maintaining chronic illness.
Yeah.
So why would you want to actually listen to advice that you can maintain your pain? What's wrong with this?
It's upsetting because there's just like kind of across the board been something where, the shops were kind of, going through their circumstances with products and stuff. And then next thing you know, this availability, and then like this kind of propaganda that kind of cut through all of a sudden and just stopped everything. And now, that person.
Well, I can tell you for certain, this person that you're talking about needs to find a new primary care doctor because they're seeing a dullard who doesn't care about them. And then the second thing is they should probably resume what they were doing that worked. It's just common sense.
Right. Would you suggest like electrolytes and like water and that sort of thing, and maintaining effective nutrition?
No, what I would suggest is, since the person got benefit and had no heart problems while using it, the heart problems happen when you do overdoses or when you first start it and you're naive to it. And so I wouldn't suggest anything other than go back to what worked. Just go back to what worked.
They were very good at limiting their consumption.
All right. Go back to what worked.
I will discuss this in detail. Thank you so much.
You're so welcome. Thanks for the call, DeAndre. Haven't heard from you in a while.
Right on. No, I'm still listening. Don't get me wrong.
Well, good.
Thank you.
So good. Have a good one.
All right, you too. Bye-bye.
Thank you there, DeAndre. And we're down to the last couple of minutes, so let's go to Brandon in Sarasota with an allergies concern. Good morning, Brandon.
Hello. Thanks for taking my call. So it's a series of, I guess the trigger was COVID-19, but I worked in an environment where I had quite a bit of mold, possible heavy metals due to tea consumption, different stuff. I was bit by a tick. I did see a bullseye on my thigh.
Did you get antibiotics?
At that time, no, I did not, because I didn't know the correlation of the tick bite and what it was. I didn't know it was a tick at the time, and I didn't connect the dots. I was diagnosed around that time with Gilbert syndrome. So I always have high anemia and red blood cell count. But basically,
actually, Gilbert syndrome is only associated with high bilirubin.
Correct. That's what I meant to say.
Okay.
So around COVID-19, I would say November of 2019, I got real sick, and I assume it's COVID-19. Because in beginning of January of 2020, I could eat a whole cheese pizza. And then at the end of January, I had severe reactions. Originally, as a child, I was anaphylaxis to dairy. Outgrew that. but a lot of my reactions that I used to have as a child all came back after COVID and after the numerous times I got it. So now I'm hyper-reactive to dairy. I'm hyper-reactive to numerous different foods, to where now gluten triggers hives. It's just a hyperinflammation. So my only assumption is that due to mold and all these different... Go ahead.
I think you're describing chronic inflammatory response syndrome, and it comes from a lot of different things. Mold actually is a huge contributor. Did you remove yourself from the mold environment?
Yes, I did.
Good, okay. And so I have witnessed that COVID response is worse in people that have mold toxicity. And when you add a tick bite and Lyme infection to that, it adds another layer of chronic inflammatory response. I would suggest that you get to a functional doctor and get a cytokine workup. There is a test called the COVID-19 cytokine storm test, and it will actually help determine how much of this is coming from post-COVID reaction, mold reaction, Lyme reaction. You can see all these on this cytokine test from, I think it's called Radiance Laboratory. Bruce Patterson is the doctor. It's brilliant, and it has been really effective for me in teasing out which direction to go with helping people get over this. But your Guillain-Barré syndrome slows down your metabolism, so it's harder for you to get over it. So you really need some help from a good functional doctor.
Okay, that's what I assumed, because my primaries were all, they were saying it was like in my head. I'm like, no, this isn't in my head.
Well, it is in your head. It truly is in your head, but they don't actually accept the fact that a cytokine storm screws up your head.
Yeah.
Like there's this whole bizarre divide in our Western medicine world where psychiatric diagnoses, which are all made up, actually hold as much weight as the medical diagnoses. And so there's this confusion about what to do about it. Like, treat the medical problem and the brain will improve.
Okay. Well, I mean, I still had slight brain fog, but still I just was able to push through it to where...
It's hard.
Numerous other places. Yeah. Cool. So how do I spell cytokine test, or just look up Bruce Patterson? He's the leader for that. And is it...
Yeah, look up Bruce Patterson.
In person.
Radiance Laboratory COVID-19 test.
Okay.
And then you'll need somebody to help interpret it. They do the interpretation right there. So you could get information from the MEM, but it would be great to have a functional doctor looking at the rest of your issues, because it's not just post-COVID syndrome. This is what I've witnessed. It's not just one thing ever, and that's the way Western medicine looks at it. We need one diagnosis and one pill, and everything's going to be better, and it never is the way.
Okay. Thank you so much.
Good luck with that.
Thank you.
You're welcome. So we are down to the last minute, and I would like to thank everybody for some really engaging questions today. Excellent. Thank you for calling. Thank you for listening. And thank you, Bill, for holding down the fort there up at WMNF. And Sage, I appreciate you answering all these callers.
Well, and to thank you, Doctor. This was another informative and rewarding Healthy Steps show. And, of course, thanks to all of our participants and listeners and supporters, you make this show exemplary. And, as the doctor said, thank you, Sage. Your answering the phones has made this show possible. Couldn't have done it without your assistance. And you have been listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. Waiting for you like a dear friend is 5 minutes of NPR News, and then get ready for the Sustainable Living Show, hosted today by Annie Ellis. And until next Monday at 10 a.m., thank you for supporting and listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa, your community conscious radio station. Stay safe, stay thoughtful, and know that you are loved.
Recording in progress.